Good morning, everyone. Today we are starting our seventh session of RACHANA SANGAMAM by Dr. Manu Krishnan K. Before the session starts, I'd like to call Ms. Ritika Kapoor to deliver the prayer.
Om Namami Dhanvantri Adidevam Surasure Vanditam Padpadanam Loke Zararuke Bhaya Mrityunasham Dhadharisham Vibhid Aushadhinam Dhanvantri Pramanatham Sarvaroge Nivarikam Ayurved Prabhaktaram Vande Pyusham Dhayakam Sarve Jana Sukhino Bhavantu Sarve Santu Niramaya Om Shantihi 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 Om.
Thank you, Ms. Ritika. So now I welcome Dr. Manu Krishnan K, who is working as Assistant Professor in the Department of Anatomy, Sharada Ayurvedic Medical College and Hospital, Mangaluru, Karnataka. On behalf of Department of Anatomy and SHIVA Ayurvedic Medical College, we welcome you to the session, sir.
Thank you.
The platform is all yours. You can continue.
Okay. So, good morning, everyone. I'm myself, Dr. Manu Krishnan K, from Assistant Professor from Sharada Ayurveda Medical College. And as we have previously discussed, we'll be discussing about the introduction of joints today. So, I'll be directly going to the topic. So, just give me a second. So, we'll begin with the session. You might have heard about the joints before, and the joint is a very common term that we use across in the medical fraternity. And you might have heard about several joint disorders, joint issues that considerably affects the mobility of the patient. So proper knowledge in the anatomy of the joints is inevitable for being a practitioner. So let's begin with the session. The joints or the articulations is also known as articulations and strong connections that joins the bones with the bones or the teeth with the bones or the cartilage with the bones of the body to one another is termed as a joint. So it can either be a bone to bone joint or teeth to bone joint or a cartilage with a bone joint. So that is what defines the joints. And each joint is specialized in its shape and structural components to control the range of motion between the parts that it connects between. So that is the basic introduction to the joints. While the classification of the joints is grossly into 4 types. The first one and the most important one, as in the view of the anatomy, is the structural classification. And the second one is the functional classification. And the third one is the regional classification and the articulating classification. So here you can see the structural classification is entirely based on the joint structure, while the functional one based on the degree of the mobility of this particular joint, and the regional classification is based on the location of the joints. And the last one, that is the articulating one, that is based on the number of articulating bones. So let's see in detail about all these kind of classifications. So the first one, that is a functional classification, that is based on the mobility of the moon or the joints. And the functional classification includes three types. The first one is diarthrosis or the synovial joints, then the synarthrosis, then the amphiarthrosis. So these are nothing but the diarthrosis means the synovial joints, which is having a high degree of movements, while the synarthrosis, that is non-synovial, which is having no movement at all. That can be told as the immovable joints. And the last one, that is the amphiarthrosis, that is the slightly movable joints. Excuse me.
Excuse me, sir.
Nothing.
Sir, I hope you are holding your screen vertically. So if you can make it horizontal, the slides will look a little bit.
One second. I'll do that.
Yeah, sir. Now it's fine. Now it's fine.
Okay.
Thank you, sir.
Okay. So the second type is the regional classification, where the joints are classified into three types. That is the skull type, the vertebral type, and the limb type. So the skull type are immovable joints, which doesn't have any kind of movements, while the vertebral type is slightly movable joints. And the third one, that is the limb type, which are the freely movable joints. So you have to note down this classification. So the first one was the functional one, then the second one is the regional classification. And the third type of classification is based on the number of articulating bonds. It's very easy to remember. There are simple joint, compound joint, and the complex joint. With the simple joint, there is only two bonds involved in the joint formation. While in a compound joint, there will be more than two bonds involved to form a joint, and they will be having a common joint capsule. So that defines the compound joint. The third one is the complex joint, where the joint is divided into two compartments by the articular discs. That you might have studied while listening to the classes on knee joint, that in the further classes you will be studying that. So there are something called the menisci, which separates the joint into two compartments. That's why it is called as the complex joint. Then comes the most important one. Being an anatomy student, you should know the structural classification very clearly, and that will help you in future for being a practitioner as well. So the joints may also be classified structurally based upon what kind of binding material is present in the joint. So the first one, that is the fibrous joints, which are made up of tough collagen fibers. And the examples for the fibrous joints are the sutures, gomphoses, and syndesmosis. While the second classification is the cartilaginous joints, which are made up of a band of cartilages that binds the bone together. For example, the symphysis pubis, you might have studied that already, which connects the two hip bones together. And the third type is the synovial joint, which features a fluid-filled space between the smooth cartilage pads. And the smooth cartilage pads are otherwise known as the articular cartilages. That reduces the friction between the two articular surfaces. And at the end of articulating bonds, they will be present, and there will be a fluid-filled space in between. And that fluid is nothing but the synovial fluid. So let's define each of the types. The first one is a fibrous joint. The bonds are joined by the fibrous tissue with no joint cavity. That's an important point to remember. There is no joint cavity present in case of a fibrous joint. And the amount of movement depends on the length of the fibers uniting the bones. And mostly these are synarthrotic and few are slightly movable. And the examples for the fibrous joints are the sutures, syndesmosis, and gomphoses. So you might be having a doubt, what are these structures? What is sutures? And what is syndesmosis? And what is gomphoses? So let's look into that. The first one is the sutures. As the term refers to, the sutures means seam, the way you stitch the clothes together. So that stitching kind of pattern in the joint is termed as the sutures. The way we articulating bone edges interdigitate, like when you are crossing the two hands together, like the fingers close to each other, that kind of suturing pattern will be present in case of the sutures. And usually it appears between those bones which are ossified in membranes. So in the previous classes about ossification and all, you might have studied the endochondral ossification and membranous ossification. In case of the membranous ossification, that forms the flat bones. For example, you can remember the skull bones and all, they are flat. And in between the skull bones, you can see interdigitating bony ridges, and that is termed as the sutures. Then the skull bones are joined by sutures, and they are the examples for that. The second type is the syndesmosis, where the articulating bones are connected by a cord or a sheet of fibrous tissue that is termed as interosseous membrane. So, as the term refers, interosseous means between the two bones, there will be a sheet of fibrous tissue and that will hold them together. So, and it allows a little bit of slight movements rather than being stiff. And for example, the distal tibiofibular joint and the interosseous membrane of forearm and the leg. So here you can see, this is the representation of the distal tibiofibular joint, where you can clearly see the two ends of the fibula and the tibia here, the lower ends of tibia and fibula, and you can see the connection between them. And that defines the syndesmosis. And the next one is the gomphosis, that is otherwise called as the peg and socket joint, where the term gompho is a Greek word meant for nail or the bolt. So you know that when you pull out the teeth, you can see a socket inside that. All of you would have pulled out your milk tooth. That time you would have seen a small pocket, like a socket like place there. Excuse me. So that defines the gomphosis. So the teeth will be stuck in the alveolar arch like as if it is hammered in. And the fibrous connection is by a short periodontal ligament. So that ligament will be holding the teeth in place. And the example, the articulation of the tooth with its bony alveolar socket is termed as the gomphosis. And the next one is the cartilaginous joint. So the previous one concludes the fibrous joints. Now we'll go with the cartilaginous joints. The cartilaginous joints are having the articulating bones united by a cartilage. So it also lacks a joint cavity. And there are two types of cartilaginous joints. They are the primary cartilaginous, which are termed as the synchondroses, and the secondary cartilaginous joints, that is termed as the symphysis. So the first one, that is the synchondroses, the bones are united by a plate of hyaline cartilage. And it is temporary in nature, as after certain age, these are ossified, and that is termed as the synostosis. So while studying the ossification process, you might have studied about the ossification of the long bones. So the long bones will be composed of, like in the childhood, it will be composed of a diaphysis and an epiphysis. And these are connected by like a plate in between. And that plate gives the bone growth. So that plate is termed as the epiphyseal plates. And so the synchondroses provide sites and the means for the bone growth, and it defines the skeletal flexibility during the youth or childhood. So the epiphyseal plates, which are seen during the ossification process, connecting the diaphysis and the epiphysis in long bones, and that is an example for the synchondroses. The symphysis, on the other hand, that is the articular surfaces, are united by a plate of fibrocartilage. And as the fibrocartilages are compressible and resilient, they act as shock absorbers. And they are slightly movable, which gives flexibility as well as strength. So here you can see the symphysis pubis, And the purpose of the symphysis pubis in females during the parturition, it allows a certain degree of movement during the delivery of the baby. So that is the point you have to remember. While in case of the vertebral joints, they allow a certain degree of movement, otherwise your spine will be straight. Your flexing of the spine is possible because it is slightly movable. Then comes the most important one, that is the synovial joints. These are freely movable joints which are composed of the following basic components. So the basic components include the subchondral bone. The chondral term refers to the cartilage. We have discussed about the articular cartilage before. So the subchondral bone, articular cartilage, the articular capsule, the synovial membrane, and the synovial fluid are inevitable components of the synovial joints. And the supportive tissues for the synovial joints includes the tendons and the muscles, then the ligaments, and the bursa, which acts as shock absorbers around the joint. So any damage to these supportive tissues can skew the joint alignment, and eventually that will cause the joint degeneration. So you might be familiar with the term osteoarthritis. And in terms of the supportive soft tissue, there has been some studies conducted in football players and all. They are more prone to get injuries on their knee joint. And similarly, when an injury happens to these soft tissues, it causes some joint misalignment, and that will in turn, during their later ages, adds up to the chances of having osteoarthritis. So there has been several studies conducted on the same. So keep that in mind. That is the clinical aspect of the synovial joints and the supportive soft tissues. And the articular cartilage, the other component of the synovial joint. The articular surfaces are covered by a thick layer of the hyaline cartilage, which is thicker in weight-bearing areas than in the non-weight-bearing areas. So in the weight-bearing areas, to reduce the friction and for smooth movement, there will be like a thicker layer of the hyaline cartilage. And the peculiar features of the articular cartilage is that it doesn't have blood circulation. It doesn't have a lymphatic drainage. And there are no neural elements for the articular cartilage. That's why if something happens, if an injury or lesion happens to the cartilage, it takes a lot of time to heal. And even the chondrocytes or the hyaline cartilage cells are shielded from immunological recognition. So another clinical point we have to discuss here, that is regarding the rheumatoid arthritis. You might have heard about the rheumatoid arthritis. That is an autoimmune condition where these chondrocytes or the cartilages will be considered as a foreign body by the body itself, and that will be destroyed on its own. And that condition leads to the inflammation of the joint, and it will affect a certain degree of the movement of the joint. So keep that in mind. These articular cartilages are affected directly by the autoimmune process. So usually they are shielded from the immunological recognition. But in certain cases, that can happen as an autoimmune response. Then the third part, that is the articular capsule. It is a sleeve-like structure surrounding the diatherosis, that is the synovial joint or freely movable joints, enclosing the synovial cavity and unites the articulating bones. So here you can see a representation of the same. Here you can see the sleeve-like articular capsule, and inside this blue color represents the synovial fluid and the joint space. So the articular capsule consists of two layers. That is the outer fibrous layer, which is a dense irregular connective tissue layer, and sometimes it will be in parallel bundles, which are termed as the ligaments. So for example, if you take the knee joint, there are two ligaments formed in such a way that the parallel bundles are formed in the articular capsule, and that examples are the tibial and fibular collateral ligaments. And there will be the second layer, that is the inner synovial membrane layer. As the name suggests, that synovial membrane is responsible for the production of the synovial fluid. and that fluid will be collected in the joint space, and that prevents the friction, and it has some other functions as well. So the synovial membrane in depth, it is consisting of two layers. The further two layers of the synovial membrane are the subintimal layer and the synovial lamina intima. So one is the outer layer and the other one is the inner layer. So the subintimal lamina is a loose vascular connective tissue with scattered fibroblasts and macrophages, mast cells, and the fat cells. So you just have to remember the names of these two layers. That will be sufficient for your exam purpose. So those who are interested in knowing it further, you can read up the remaining part as well. So the synovial lamina intima, it also shows variations, but consists basically of 1 to 4 layers of synovial cells or synoviocytes. And this concludes the synovial membrane. So the synovial membrane is composed of two layers, the subintimal lamina and the synovial lamina intima. The synoviocytes, they are the cells which forms the synovial membrane, which is classified into two types. That is the type A synoviocytes and the type B synoviocytes. Only that much we have to remember from this slide. And the synovial fluid is a repeated question where you have to define it in short terms. So for that, you have to have a knowledge about the layers of synovial membrane, and you have to say about the types of synoviocytes, and then you have to define what is synovial fluid. So the synovial fluid consists of hyaluronic acid.
इधर लेके आ ड्रामे मत कर आ गया मेरे मैं भी अपना ईयरफोन है मैं तो इधर
And I'll continue with the same. So the synovial fluid consists of the hyaluronic acid and the interstitial fluid derived from the blood plasma or the serum. And very specifically, the synovial fluid is having a consistency of the egg white, and the quantity varies according to the joint, where the largest joint we will consider as the knee joint, and even in that joint only 3 to 4 ml of fluid is only present. So you can imagine how much will be the quantity of the synovial fluid. It will be a thin film of the fluid which will be covering the articular surfaces. And let's come to the types of the synovial joints. So based on the type and shape of the articular surfaces, which in turn determine the movements allowed, the synovial joints are classified into 6 major categories. So remember, the synovial joints are further classified into 6 categories. The first one being the plane joints, where the articulating surfaces are essentially flat, and it allows only short slipping movements or the gliding movements. Hence, they are also known as gliding joints. And it comes under the non-axial joints, where the gliding does not involve rotation around any axis. So here we have a representation of the same. On the side, you can see the representation of a plane joint, which is having the articular surfaces which are plane, and it allows a gliding kind of movement, and hence it is otherwise known as the gliding joint. The examples include the intercarpal, the intertarsal joints, and the joints between the vertebral articular process. So this defines the first type of synovial joint, that is the plane joint or gliding joint. The second one is the hinge joint, which is an easy part you can remember. The hinge joints, they are convex or cylindrical processes of one bond fits into a trough-shaped surface on the other. The hinges, you have seen about the hinges of windows, you have seen the hinges of doors and everything. They allow a certain degree of movements only. And the movement is along a single plane. That's why it is called as the uniaxial joint. And is similar to that of the mechanical hinge that we see in case of windows and all. So the two movements possible in hinge joints is the flexion and extension. The best example for the hinge joints are the elbow joints. and the interphalangeal joints, where it only just we can only flex and extend. We can't do any other movements with that particular joints. So the second type is the hinge joints. So this defines the hinge joint. You can see the representation of the elbow joint here, the lower end of humerus, and you can see the ulna, the olecranon process and the trochlear notch that will be fixing into the trochlea here. That allows the movement, that is a flexion and extension of elbow. Then the third type is the pivot joints. The rounded or conical end of one bone protrudes into a sleeve-like ring composed of a bone or a ligament of another bone, and that will allow the rotatory movement. And the movement allowed is the uniaxial rotation of one bone around its own long axis or against the other. So that is what defines the pivot joint. The movement allowed is uniaxial rotation. And for example, the best example is the proximal radioulnar joint, where the radius, the head of the radius, you can see here, the head of the radius is covered by an annular ring, and it allows a degree of uniaxial rotation inside the sink. So that helps in the pronation and supination movement. The fourth one, that is the condyloid joints or the ellipsoid joints, where the oval articular surface of one bone fits into the complementary concavity in another. And important characteristic is that both articulating surfaces are oval in shape. That is the peculiarity of the condyloid joints. Both the articulating surfaces will be oval in shape, and they are biaxial and permit all angular motions. It can make movements in all angles, and that is called as the biaxial joint, which permits all angular motions. And the best example for that is the radiocarpal joint and the metacarpophalangeal joints. And another variety of the condyloid joint is the bicondylar joints. So as the term suggests, bicondyle means there are two articular condyles, which are convex, which is articulating with two concave surfaces. And it acts as modified hinges, having a main movement along a single plane like that of a hinge joint. But sometimes we also exhibit some kind of rotational movement as well. That's why they are separately classified under the condyloid joints. Rather than the flexion and extension, what we have seen in the hinge joints, here in bicondylar joints, they exhibit some rotational movement as well. And then comes the saddle joints. So the saddle, the term is very clear for you that the horse saddles you will be remembering, like that will be placed over the horse, and that is used for the horse ride and all. So each articular surface has both convex and concave areas like a saddle. And the articular surfaces fit together concave to the convex surfaces. So here we have the representation. You can see how the saddle joints are formed. So the one convex surface and the other one will be the concave surface. And the difference from the other joints is that they allow a greater freedom of movement. That's why they are called as a saddle joint, because of this particular formation here. There is a convex and concave surface which is locking with each other, and it has some higher degree of movements as well. And the last one, and the most easy one to remember, is the ball and socket joints. So as the name suggests, there is a spherical or hemispherical head of one bone which articulates with a socket or cup-shaped part of the other bone. So the best example for that is the shoulder joint and the hip joint, where you can see, here you can see a clear representation of the same. Here there is a hip joint. In the hip joint, you can see the head of the femur, which will be fitting into the acetabulum of hip bone. And this allows a higher degree of movement. And that's why it is called as multi-axial joint, and it is the most freely moving synovial joints. So the other synovial joints only allow a certain degree of movements, while this one, the ball and socket joints, just give a free degree of movement than any other of the synovial joints. And the best examples include the shoulder and the hip joints. So this concludes the introduction to the joints and its classification. So if you want, you can note down the classification, including all the synovial joints. The first one is a gliding joint, and with the examples, the acromioclavicular and the sternoclavicular joints, then the intercarpal and the intertarsal joints, the vertebrocostal joints, and the sacroiliac joints. So this table you can just copy down. That will be helpful for your exam presentation. And always try to follow the same pattern what we have done through the class. Initially start with the basic definition of the joints, then go for the classification chart, how they are classified functionally, structurally, regionally, and according to the movements. Then individually explain each types and classify the names and give down the examples. So that is the way how you should answer for the question, like asking for the introduction or the classification of the joints. And I guess you have already covered through the Sandhi Sharira. So that can also be incorporated into the same, and that can be utilized for the exam purpose. Thank you.
Thank you, sir. So the platform is open for discussion. If anyone have any questions or if anyone wants any slides to be repeated, you can kindly ask sir to do the same. Sir, I got a doubt. Yeah, sir, can you kindly show that slide of classification of joints once more?
Sure. The first one, right?
Yeah.
This one, right?
Yes.
Should I explain once again?
Yeah, I got a doubt from one student. Can you just explain? Because at that time, I think the screen was vertical and students could not.
Okay, sir, it's no problem. I'll explain that once again. So this is the basic classification of the joints, where you have to just write down the classification according to different aspects. So the first one is nothing but the structural classification of joints. So this one is the structural classification of joints, and it is purely based on the joint structure. So the anatomy of the joint, while considering that, we have to take this classification into action. And this one includes the structural classification includes the fibrous joints, the cartilaginous joints, and the synovial joints. And the further classification we have concluded in the further slides. So I'll go with the next classification, that is a functional classification. As the name suggests, it is based on the degree of mobility of that particular joints. So the first one, the synarthrosis, it is immovable joints, while the diarthrosis is the freely movable joints. And in between, the amphiarthrosis are nothing but slightly movable joints. And the third classification is based on the regional classification, which includes the skull type, which is immovable joints. Then we have the vertebral type, that is slightly movable joints. And finally, we have the limb type, that is a freely movable joints. And the final classification is based on the number of articulating bonds. So as we have discussed about the definition of the joints, it is defined as the articulating bonds, like when one or two bonds articulate with each other, or if a bone is articulating with a T, or if a cartilage is articulating with a bone, these are considered to be the joints. So here, based on the number of articulating bonds, they are classified into simple joint, a compound joint, and a complex joint. So these are the classifications. Hope your doubt is cleared. And if you have any further doubts, you can ask.
Yes, sir. Sir, you explained about a synovial joint.
Okay,
Can you repeat that slide once more?
sure. So the synovial joints is a group of freely movable joints. So the basic structure you have to explain, like sometimes the question may come as like explain the shoulder joint or explain the knee joint or explain some other joints. So in that case, if it is a synovial joint, it is always better if you answer with an introduction with the basics of the synovial joint. You can explain that this particular joint is coming under the synovial joint variety, and all synovial joints will have some common features. So that's why I've included this slide where you can just note down the basic components of the synovial joints, which includes there is a subchondral bone. So this bone over here is termed as a subchondral bone, the bone that is lying below the articular cartilage. Then comes the blue colored area here. The articulating surface is covered by a thin layer of hyaline cartilage, that is the articular cartilage. And here you can see this green and green colored area, and there is a capsule like covering over the complete joint, and that is termed as the articular capsule. And inside that, there will be a lining of membrane, which is called as the synovial membrane. And that helps in production of the synovial fluid, which fills up the space here. The space over here is nothing but the synovial cavity, and that space is occupied by the synovial fluid. It won't be this big, but still there will be a thin film of synovial fluid in there. And that synovial fluid is secreted by the inner layer of the articular capsule, that is the synovial membrane. So that will be particularly stored inside the space, and that fluid filled space is termed as the synovial cavity. So these are the common features of the synovial joints, which you have to remember. And these synovial joints are supported by certain outside structures. So that's what we defined as the tendons and the muscles. So here you can see the tendons and muscles, which is around the particular synovial joint, which will stabilize the joint to further extent. So if it was only covered by the capsule, there are maximum chances that the joint can get injured with minor external forces. So to prevent that from happening, there are some supportive structures or supportive soft tissue structures which cover the particular joint. So it depends upon the area, and in case of knee joint or shoulder joint, there is a muscles. There are muscles that are covering the particular joint. There are some bony structures which are over it. There are some other ligaments which are supporting the joints. That we'll be studying in the next class about the shoulder joint. So here you can see the muscles, and there are ligaments which are supporting the synovial joint, and there will be small packets of synovial fluid covered in synovial membrane that will be covering different areas where there is maximum chances for friction. So that will prevent a particular extent of the joint injuries. So hope that area is clear. Should I explain the further ones?
Sir, one more doubt.
Okay,
Yeah. So can you explain futures once more?
sure. So as we have told earlier, the fibrous joint is termed as the non-movable joints. In that kind of joints, there is further classification as sutures, syndesmosis, and gomphoses. So we have covered the sutures first. And in case of sutures, they are like, I'll just draw and show you here. Just a second. So consider this as a skull here. And you have seen the sutural patterns on the skull like this. So there will be like a interdigitating with each other. The skull bones will be connected together by this interdigitating kind of joints, and that joints is termed as the sutural joints. So the wavy articulating bone, so here as we have described, the wavy articulating bone ridges interdigitate by either overlapping or interlocking. So here you can see interdigitations and interlocking, and it usually happens between the bones which ossify in membranes. So you can consider the flat bones in general, especially the cranial bones, which are joined together very firmly by this interdigitating seams that is termed as the sutures. Hope it is clear for you.
Yes, sir. So one more doubt came in the chat.
Okay, sir.
So please explain ellipsoid and pivot joint again.
Okay, fine. So here we will begin with the pivot joints. So the pivot is nothing but there is a central axis, and around that there will be the rotational movement. For example, like have you ever thought of like how you will turn your head sidewise, how the rotation is possible for the neck? So there is actually, here you can see, the atlas bone and the axis bone, where there is a process that is called the odentate process extending up to the atlas bone, and that will be held in place by a ligament. And this allows the rotatory movements along the central axis. So there is a central process, and the movement happens in rotatory movement as like this, what I'm showing here. And the same thing I can draw here and show you. So there is a central axis, and the movement will always be around it. So that rotatory movements is termed as the pivot mechanism. And the rounded or conical end of one bone, so here you can see the rounded or conical end of one bone protrudes into a sleeve-like or a ring composed of a bone or ligament. So here we have a representation of the radius and ulna, which are held, the head of the radius is held in place by the annular ligament, that is a ring-like ligament. So the rotatory movement happens in the uniaxial rotation. So it rotates on its own axis. So that is termed as the pivot mechanism. Hope you understood the pivot joint. And we'll go with the next one, the ellipsoid joint. So in case of the ellipsoid joint or the condyloid joint, there will be oval articular surfaces. So the wrist joint you will be knowing, right? So when you are there is a long major high degree of movements that is possible with the wrist joint. You can flex it, you can extend it, and then you can do medial rotation, like you can turn it inwards, you can turn it outward. So all these movements are possible because of a reason that they fits like a on the complementary concavity in each another. And you can see the important characteristics. Here you can see the oval surfaces. So being the oval surface, it allows a certain more degree of movement, and angular movements are also possible. And that is the reason for the flexibility of the wrist joint. So that is why you can do a more degree of movements with the wrist joint rather than just being extension and flexion. So that defines the condyloid joints.
If there are any further doubts, you can put that in the chat box. Sir, I hope there are no further doubts.
Okay, sir.
So I think we can wind up today's session.
Okay, and tomorrow we'll be continuing with the shoulder joint.
Yes, sir. Yes, sir. So we thank you so much for spending your 1 hour of time with us. So see you tomorrow. Stay safe and have a great day.
And thank you for the opportunity. And tomorrow we'll discuss about the
Sure.
shoulder joint.
Just ending up the session.
Okay. And I'll be sharing the PDFs that can be given to the students.
Yeah, yeah, sir. Yes, sir. Thank you, sir.
Sure.
Okay, sir. Have a great day.